Hi, good morning, everyone. I'm Dr. Mok from the Department of Surgery in Changi General Hospital. The topic of my talk today is the breast assured, common breast problems in women. This is a topic overview of my talk today. I will be touching on common breast issues or breast problems such as breast pain, nipple discharge, or breast lump. I will also be explaining to you how to do a breast self-examination, how to detect breast cancer early, a little bit of information about mammogram, as well as a summary of my talk today. So, are all breast pain equal to breast cancer? The good news is that breast pain is rarely a symptom of cancer. So then, why do we have breast pain? Breast pain can be broadly divided into two types. The firstly being cyclical breast pain. This refers to the discomfort caused by an imbalance in hormone levels in a woman's body. And this is more common in premenopausal women. The other type of breast pain are also commonly known as non-cyclical breast pain. It is caused by any other reason other than hormonal changes. And this can happen in both pre- and post-menopausal ladies. As we can see in this picture, not only the breast, but around the breast area, there is actually masses, there is actually rape, and there is actually cartilages or the bones nearby known as sternum, and this can all be causes of pain other than those caused by normal hormonal changes. And when we talk about breast-related non-cyclical breast pain, it can be any inflammation or infection known as mastitis or a breast abscess. For non-breast pathology, bone pain or cartilaginous pain are also known as costochondritis or musculoskeletal pain. A very common cause of non-cyclical breast pain that is not due to any bodily problems or pathology are actually ill-fitting bra. And so it is therefore important to recognize the causes of the pain before we can actually find the root cause and treat the pain. So the second most common problem that we commonly see in ladies is actually nipple discharge. So there are many types of nipple discharge. It can either be bloody, milky, or any other color such as brown, greenish, or blackish nipple discharge. So there are many causes to it, more than what I've shown in this slide. Most of my patients will ask me, are all nipple discharge alone equals to breast cancer? The answer is only less than 10% of nipple discharge alone as the presenting complaint are due to breast cancer. So what are the causes of nipple discharge? Of course, nipple discharge can be normal in lactating ladies, and the nature of the nipple discharge is normally milky. All other nipple discharge are then considered abnormal. So I would actually advise everyone to see a doctor if you do have a nipple discharge. But it doesn't mean that every abnormal discharge needs to be treated and is related to a pathological cause such as cancer. So one of the common abnormal causes of nipple discharge is known as ductectasia, which means to say that the milk ducts are actually a little bit swollen and enlarged. This is commonly seen in post-menopausal ladies, and the discharge in this case can be either yellow, green, or brown. and the discharge normally comes from more than one duct. But glad to say that this condition does not increase the risk of breast cancer. Other causes of nipple discharge are also known as intraductal papilloma. This is a benign growth that normally grows within the milk ducts. And the nipple discharge that results from an intraductal papilloma can either be clear or bloodstained discharge. Intraductal papilloma can be associated with cancer. I normally give this analogy to all my patients. Intraductal papilloma is like an angel, but it does have the devil side to it, or it makes bad friends. And the bad friends is actually breast cancer. So for ladies with intraductal papilloma, it is important to make sure that there is no associated breast cancer or other high-risk lesions around it. Other causes of nipple discharge that requires the root cause to be identified are, for example, hormonal causes. And that is meant to say that there is abnormal hormone production by diseases elsewhere in the body. And this has to be differentiated from milky discharge in lactating ladies, as some of the hormonal causes can result in milky discharge as well. There are also certain medications that can result in nipple discharge. For example, certain high blood pressure medications or certain mood medications. So if you're on certain medications and you happen to have nipple discharge, it's always safer to actually visit a breast surgeon or a breast specialist so that it can be ascertained as to whether the medications are the cause to the nipple discharge. Hormonal causes or medications causes of nipple discharge, however, it is reassuring to say that they do not increase the risk of breast cancer. When is nipple discharge a cause for concern? Firstly, if there is nipple discharge in a non-lactating lady. Secondly, if the nipple discharge is spontaneous. Unilateral, meaning from one breast. Confined to a single duct or opening, either when it is clear or bloodstained. And of course, if there is nipple discharge in presence along with other symptoms, such as a breast lump, ulceration, or changes to the nipple, they are all concerned and a cause for concern for you to see a breast doctor or a breast specialist as soon as possible. Next, we move on to another common breast problems that we normally see in ladies, and that is breast lump. But the good news again is that 80% of the breast lumps are actually non-cancerous. So then, what could be the causes of breast lumps? There are actually many benign causes of breast lumps. I wouldn't go into the details of it, but I have listed down a few common causes that we see in either pre or post-menopausal ladies. The first one here is what is known as fibrocystic changes of the breast, and it is actually referring to changes that we normally expect in either pre or post-menopausal ladies because of normal hormonal changes. The second type of breast lumps are also known as fibroadenomas. They commonly occurs in younger ladies between 20 to 40 years old. Of course, breast cysts, which can occur in any age group, can also present as a breast lump. Commonly, when I see my patients, I have this reaction that my patients normally give me. And why is that so? Is because when I ask them if they actually do their self-examination, either I don't know how to check, I don't know how a lump should feel like, or I don't know when's a good time for me to do so. So then I'll be taking this opportunity through this talk to actually teach all of you how to do a breast self-examination. So this is a breast self-examination guide that actually I took it from Singapore Cancer Society.
It is actually just 3 easy steps, what is known as look, touch, and check. So for step 1, to look, what to look out for. Firstly, put your hands on your hips and look out for changes in number 1, the breast shape. Whether there is any dimpling, any hard lumps, any bumps, any abnormal looking veins, or any thickened areas of the skin. You also look at the skin surface for any ulceration or sores, any part of the skin that looks red and abnormal. And of course, lastly, look around the nipple area for any changes to your nipple, any nipple discharge, or any sunken nipple, for example. And then now, after you have had a close look at all those 3 areas, raise your arms above your head to look for changes, especially any dimpling on the underside of your breast. Step 2 of the breast self-examination is actually touch. So feel your breast using your middle 3 fingers, moving in a circular motion from the outer area slowly towards the nipple. And gently squeeze your nipple, lastly, to check for any nipple discharge. And repeat this step for the other breast. Step 3 and the last step for the examination is actually to check. Now you check for any lumps by examining your entire breast from your armpit to your cleavage with different pressure. And of course, remember, repeat this step for the other side as well. So then, when is a good time, or when should you do your self-examination? So I will normally give this guide to all my patients. It actually depends on your menopause status. For ladies who are premenopausal, I normally encourage them to do their self-check once a month, about 7 to 10 days after the start of your menses. The reason being, there will always be discomfort and soreness just before your menses, hence precluding a proper and thorough self-examination. Whereas for postmenopausal lady, it's also once a month, but you can examine yourself any time of the month. The last part of common issues that we commonly see, and in fact with increasing incidence, is actually that of breast cancer. A lot of my patients tell me, or in fact a lot of misconceptions that my patients have is that if, let's say, they feel otherwise alright, or they have actually have previous mammogram done before and they are normal, so actually what do they have to take note of? And is that all that they need, and they do not need to do anything else? So the risk of breast cancer actually increases with age. We can see that majority of ladies with breast cancer fall within the age group of 40 to 70 years old. And breast cancer is actually the top cancer in ladies in Singapore, and this is from the National Registry of Diseases Office data from the Singapore Cancer Registry from the year 2011 to 2015. So what are the physical signs of breast cancer? Breast cancer, as you can see from this diagram here, by using the lemon as an example, there can be many changes. That there may be an underlying cancer, from all the way from just filling a thickened area over your skin to actually a hard lump or even a skin sores. But are these signs what we are worried about the most? The answer is yes and no, because what we are most worried are those breast cancer that present with no symptoms at all, and you don't feel anything at all. If let's say there's no symptoms, how do we then detect breast cancer in its very early stages? This is the golden word, a mammogram. So a mammogram is actually able to detect breast cancer in its very early stages. A mammogram is actually an X-ray examination with a compression of the breast, and this only lasts for a few seconds. So this is how a normal mammogram should look like. And when the breast lump is felt, you can see here as pointed by the red arrow here, this is how the lump would look like. However, when it's very early, before you can even feel a lump, how would your mammogram show? As we can see here in these two pictures and the magnification view here, we can see that these are all white little spots or dots that is commonly known as microcalcifications, and these are calcium deposits. So in cases of early breast cancer, before a lump has formed, cancer can actually show up as just calcium deposits or microcalcifications that is only seen on mammogram. So therefore, we'll always say that early detection saves lives. And because of the simple fact that if we discover cancer early, be it breast cancer or other cancer, the cure rate is actually very, very high. So then a lot of my patients come in, a lot of ladies that I see, they actually have the idea that only older women need mammogram, or they would think that if they have no family history, that equals no risk and thereby no need for mammogram. Some says that they are worried that radiation from mammogram actually causes cancer. Mammograms are painful. Are all this real? The answer is no. I'm going to bust the myth today. So of course, I wouldn't say that mammogram will not be painful. There will of course be a little bit of discomfort, but we do have some tips for a more comfortable mammogram. For example, schedule your mammogram about 10 to 14 days after you start your menstrual cycle, as the breasts are usually less tender at this point. Some studies do show that if you avoid caffeine a week before your mammogram, it can actually make the breast less tender. Lastly, and actually I would say most importantly, if you experience any pain, do inform our radiographer, as some simple repositioning may actually help with the discomfort. We all know that Health Promotion Board actually conducts a nationwide screening program in conjunction with several polyclinics nationwide. Under this national screening program, there's actually subsidized mammography screening available to all Singaporean ladies or permanent residents aged 40 years old and above. And commonly, because it is a screening program, patients should have no symptoms such as breast lump or nipple discharge. And of course, shouldn't have had mammogram in the last 12 months to be eligible for the screening program. In this picture here, I just would like to show that actually the accessibility of breast screening services in Singapore is actually very widespread. So there's no reason why we shouldn't have an access to screening mammogram. And I have this slide because I have a very important message to show all of you. This is a very important slide because it is actually a reminder for you to go for your regular screening as well as to perform regular self-examination. So we encourage any ladies above the age of 20 years old to start doing their self-examination on a monthly basis. For ladies who are 40 years old and above, please go for your screening mammogram, and the interval is actually yearly when you're aged 40 to 49 years old, and every 2 years when you're 50 years old and above. This is a very important slide because this is to remind you to see a doctor when you actually notice any breast pain, you have any breast lump or nipple discharge. In fact, if you have any other discomfort or if you are worried. And last but not the least, go for your screening mammogram if you are at an eligible age, even if you feel fine and your previous results are normal. And that is actually the end of my talk today. I'm more than happy to take any questions. Thank you very much and have a great day.